So will you please welcome Yvonne Goff.
Thanks everybody, it's lovely to be here, and I'm from Waterford. I don't see it too often, unfortunately. Or certainly we don't come out successful every time we come here. So I'm going to talk a little bit about a very large reform programme we're currently going through and how we're approaching that in terms of our approach to change. So we're currently going through one of the biggest reform programmes in decades in the HSE and indeed in the Department of Health, where we're establishing 6 regional health areas, and we're becoming a far more strategic lean centre. And in terms of scale, in terms of scale of the RHAs, so the RHAs, there's 6 of them. Some of them will have a population of up to 1 million, and some will have a budget of up to 4 to 5 billion. So they're huge organisations in their own right. And we're looking to devolve responsibility and authority and decision-making to these regional health areas. So it's a very large reform programme. And in terms of the key challenges when dealing with this change and this type of changes, we have a staff and a workforce who continue to work in a pandemic, in a COVID environment. So there's significant stress on our health service at the moment. So we're bringing a workforce along this change journey when they're already dealing with this additional workload. And they're also very apprehensive in terms of what does this mean to them? What are the decisions we're making with them, for them, in terms of delivering on the regional health areas? And do we have the capacity and capability to deliver on this reform programme and deliver our service effectively and safely? So these are some of the key considerations for us. So for those who don't know our current structures, so we have 7 hospital groups and 9 community healthcare organisations. The governance and funding arrangements are along acute and community lines. Their boundaries don't align, and their fragmentation in terms of gaps for patients transitioning from acute to community and vice versa, and indeed within community, because we're funding along care group lines. We're not funding on a population-based approach. So there's an absence of effective integrated population-based planning, and there's limited scope for localised decision-making. So this is not leading to a picture that will allow us for integrated care. That's why we're moving to regional health areas. So in terms of some of our strategic objectives, as I said, we're seeking to align hospital and community-based services into one region, into 6 regions. You can see the map there in colour there, to support a population-based approach to the planning and delivery of service, and to clarify and strengthen healthcare governance. And the HSE Centre is becoming leaner and focusing on national consistency, national frameworks, where we're devolving responsibility and authority and decision-making to the regions. So in terms of where we are now, so we have completed a high-level functional design for the RHAs, for National HSE and DOH, and that will have to go through and be tested by the system to see, are we devolving enough? Is it the right answer? Is this going to lead to integrated care? Are we addressing our current barriers to integrated care? So we're closing out on the RHA implementation plan and hopefully being brought to government in early 2023. And we'll continue in 2023 around the design of integrated service delivery model. And what does that mean? It's how we organise ourselves within a region to make sure that we deliver integrated care. Because what we don't want to do, because we have very large entities here, create 6 mini HSEs. It's very important that we focus on the ground up and make sure that we are organising ourselves within an RHA to deliver on integrated care, to become far more joined up. We're going to finalise a plan for key essential elements. So what needs to be in place on January 2024? Will we be standing down our CHOs? Will we be standing down our hospital groups? What teams will be in place? What processes will be changed? All that needs to be worked out and documented in the RHA implementation plan. So we're very clear in terms of what day one in January 2024 will look like, and it won't be the future vision. It'll be what is achievable in terms of our ability to move our workforce and all our key enablers at pace to bring us on this journey of regional health areas. We'll commence the recruitment of the regional health area chief executive officers, and we'll also have ongoing engagement and communication with relevant stakeholders to keep testing the design and to keep moving forward with the implementation. So I'm just going to focus on a few of the key principles of getting right in terms of managing change, and not just the change of the RHA. Sorry, I'm just going to move my own notes so I get this right. Not just the change in terms of RHA, but in typical leading large-scale transformation programs. So the first is making sure that our leadership get it, that they sponsor this change, that they lead by example, that they work with us to address any of the barriers to delivering on this change. Connecting with the grassroots. So we have to connect with the people who are actually delivering our services. They need to test any of the design. It needs to be co-designed with them in collaboration. A few of the other things I would call out, thinking big and start small. So we have a mandate now, which is fantastic, to think really big with this RHA, to really reimagine how we deliver our services within an RHA. But we shouldn't keep holding the movement until we have all the answers. So we need to start making incremental progress towards the future vision and making sure that the organisation is fit for purpose, so that we can, again, have a mandate to look at our processes and modernise and reimagine how we deliver our services. Number 7, so that's a generic sentence, focusing on our customer. For us, our customer has to be the patient. We need to put the patient at the centre of everything we do, their families, the public, and our staff, to make sure that we're focusing on them. Answering the so what. So this can't be change or structural change for the sake of structural change. We have to be very clear in terms of why we're doing it, why it's important, what is it addressing, how we'll make sure that we deliver integrated care through this, and be very clear. Otherwise, people won't buy into it if they don't see themselves in it, if they don't see why we're doing this change programme. In terms of the RHA and specifically some of the things that we're looking at in managing the change process within the RHAs. So we're looking at a few particular important points. So one is to encourage leaders and their staff that are ensuring that our leaders and our staff are ready and prepared for change. So our leaders in our hospital groups, in our CHOs, our staff, are they ready for the change? Do they understand the impact of the change? Have they got the supports required to drive forward in this change? The next is understanding system capacity and building change capability, very much linked to number 1. So to really understand the impact on any of our decisions, and are we ready for the change? What capability do we have? What capacity do we have to support this change? And how can we give people the supports they need? How can we support that? Harnessing data to inform change plans and implementation. So using any data source we can, evidence from, we'll hear from the NHS in a minute, but evidence from national and international previous restructuring, have they addressed the barriers of integrated care, and can we learn from that? And can we learn from when we've done it ourselves many times before? And redesigning work to promote integration. So I was talking about earlier on around looking at our processes, reimagining what is working well. Ronan spoke to me earlier on around demonstrators, making sure that we don't, throw out the good, that we scale the good and reimagine how we deliver processes within the HSE. So in terms of, I won't keep you too long now, I won't go through all these, but it's ensuring leaders and staff are prepared for the change. So change readiness is critical to the success of any change programme, and it's no different for the RHA. So it's very important that we ensure that our leaders are ready for change and they're supported through this change journey. And number 2 there is very important, that any change that we are proposing, that is, the impact of it is tested and measured, and that we understand What is the impact on our staff? What is the impact on our patients? What's the impact on the service? And are people ready to move forward with that change? The next one is very linked to the previous one, as I talked about the capability and capacity to deliver change. We need to be very clear in terms of, do we have that capacity while also delivering safe, quality services? So one of the approaches we're taking is any of the changes, we're prioritising them and planning them against people that are ready and services that are ready to receive that. The next is around the quick win. So I spoke about previously around that we have a mandate for radical change here, but we need to build confidence that we are making this change and move forward this year with implementation and keep implementing over a number of years to realise the vision of the establishment of the RHAs. Harnessing data to inform our change plans. So we have done a huge amount in terms of what other countries have done in terms of restructuring, why they have restructured, have they achieved what they sought to achieve, what can we learn from them. We've also done this a lot ourselves. There's been ISAs, there's been health boards, we've a lot of restructuring done, the hospital groups, CHOs. What can we learn from that? And it's very important that we keep the good and that we just build on the good and revise to make sure that we move forward to delivering on integrated care. And finally, I suppose it's about redesigning and building on what's good. So looking at the community health networks, looking at the hospital networks, mental health networks, disability networks, making sure we build on all that and building it into our future design within the RHAs. And also, we have the opportunity now more than ever to utilise technology to support us on the delivery of new models of care, new ways of working within the RHA, new ways of working within the HSC Centre and the DOH. I think that's it from me. I hope I've given you a sense of the RHA programme, the scale of the change that's required, and our approach to addressing that as a programme. Okay, thank you very much.
Thanks very much, Yvonne. Very, very interesting. Lots of food for thought there. The whole RHA programme is very interesting, and I suspect many people in the room will be at different stages of understanding. Certainly I learnt a lot there that I didn't already know. So I guess, any questions from the floor for Yvonne? Yes, have we a microphone there somewhere? Okay, fire away.
Sorry, the next question with regards to the previous discussion. How does the sort of digital strategy build into the sort of infrastructure piece with the RHA?
I wasn't at the previous, but I can answer that anyway, okay. So data is very important to us. So one of the things we need to be clear about, how do we measure integrated care and how do we measure the impact of our change. So we know we don't have the underlying systems, particularly in the community, to measure that at the moment. So the very first thing we're doing is defining what are the key KPIs that we need to measure to make sure that we are delivering on integrated care, and then map that to a data strategy to do that gap analysis to see what systems do we need to put in place to make sure that from a management perspective you have the performance indicators, but also from a staffing perspective you can have collaborative ways of working and you have the information you need at hand to care for your patients. So it'll all be very much linked, because it will not be successful without a very clear integrated data strategy.
Hi, Yvonne. Thanks. It's really interesting. Similar to that question, I'm wondering, will the ICT services turn around to become RHA focused, or, if you're replacing, say, the childhood vaccination system in RHA, will that be a national type project still under community?
Yeah, so the main principle is that the HSC Centre would describe the what, and the RHAs would deliver on the how. So in terms of ICT, for instance, so there's discussions at the moment in terms of if it's within a national framework and standards and, you know, integration standards and coding, that the RHA themselves would deliver on those programs, but it's within a national framework is the thinking at the moment. And as I said, there's a huge amount of thinking to be done and testing of that to validate, will that actually work, and will that devolve enough authority to the regions? So all to be worked out on that one.
And then, you know, presumably if there's a framework, say, for whatever the system is, will there be something built in to extract that to all the national picture, so that disease registries, for instance, can be developed?
Absolutely, absolutely. Yeah. It'll be all part of the integrated data strategy. Yeah.
Yeah, at the very back there.
So along the same lines, I'm wondering about your digital strategy as opposed to your data strategy.
Yeah.
So with the implementation and deployment of digital technologies,
Mm-hmm.
will the procurement and deployment be a regional strategy and implementation, or will it be national, or are you still working on that?
Still working on that, but the sense is that that a lot of the national standards will be set nationally, and because I suppose the pie in terms of the budget for ICT is not enormous, so we need to work together to make sure that we have a very clear prioritization process, because you know, for instance, from a regulation perspective, we have to stay within 2 upgrades, versions controls. But it mightn't be the priority for the region to upgrade, you know, back-end systems and stuff like that. So it's about finding that balance between national standards and local requirements to move forward with new developments as well. All right. So I said early 2023, right? Not January. No, not at all. So it'll talk about the ambition for the RHAs. It will talk about the proposed integrated service delivery model within the RHAs. It will talk about what needs to be achieved by January 2024. So it'll talk about what will be stood up and what will be stood down, what teams will be in place. So that's kind of sense of what will be within the RHA implementation plan. For all 6 RHAs, yeah. I say the gentleman next door to you will tell you that'll probably be published, I'd imagine, Merge, will it? Yeah. Yeah. I suppose it's very important that, you know, that it's the right implementation plan, that we work with the system to validate all this thinking. So I know it's very important. Like, this is a massive change program, and we do need to be moving forward with it. But we need to give enough information that the system has tested and communicated with the system to make sure that it is the right plan as well. That's the challenge there. Yeah.
Priority or prioritising of transformation, will that be led at the regional level? And will they be given like a pot of money and they can carve it up as they wish? Or, because at the moment the procurement cycle in business cases is quite protracted. I just wonder, you know, will the IJ have more autonomy and be able to do things a lot quicker than what we see today?
Yes, they will. Yes, yes. So they will develop their own strategic plans for transformation within their own region. And this, oh yeah, Martin.
Sorry, just a very basic question, right? Will the CEOs of the new RHAs, will they have full jurisdiction over both acute and community services in their region?
Yes, yes.
And who will they report to?
The CEO of the HSE.
I just want to lose the focus on digital transformation.
Yep. Yep.
Again, communication.
Mm-hmm.
So everybody in the room is very interested in how this will be set up and implemented.
Mm-hmm.
If you can have all the digital
Sorry, Mert.
The problem is, if you don't communicate, and for all I ask everybody who was a doctor in the hospital, and there's hardly anybody here. There was, and GPs didn't seem to be too many. The whole essence of healthcare is moving patients between GPs, primary care, and hospitals smoothly, and maybe keeping them off to the left of the GPs. And that's not working since COVID. A whole lot of lessons to learn since COVID. Huge number of people worked very hard, came out of it really, really well. But in hindsight, in the rearview mirror, there were some mistakes that we shouldn't make going forward to the RHS. And mistakes were such a focus was on protecting, the service, stopping deaths, all of that, which of course was sensible. That we totally lost focus on elective care, waiting lists, clinics, primary care, routine GP care, and that's coming back to destroy us now in the emergency crisis we have. And if we focus only on the A&E crisis, we'll make worse the elective problems. That the RHS are going to have to.
Yeah.
So we need to broaden focus. Now, the whole key of this is the communication between primary care and CHOs, whatever you like to call it, and the hospitals. And that is such an easy thing to say, and it's such an incredibly difficult thing to achieve. And I'd just like to know, are there any implementation plans for communication?
Gary, that's a very good question. There isn't, to be very frank, so we have to work with yourselves we're testing the integrated service delivery model within an RHA. So things like that, we're hoping to go out to GP communities, to service leaders, to really see, will this address the barriers with how we organise, and taking into consideration things like what you're saying, Gary, needs to go into that fold. Are we addressing it? Are we addressing our relationship with the GPs, with the voluntary sector, all that? Is this change going to address those barriers? And that is all to be tested. So it isn't, be very frank, it's not there now. It has to be tested within the integrated service delivery model. Yeah.
Can I ask you a question, Yvonne? Just can we address briefly the elephant in the room? When you're talking about RHAs, what do you say to people who say this is just adding another level of bureaucracy on top of an already over-bureaucratised system? And how will the program that you've outlined, how will that impact where the rubber meets the road, the patient versus where the patient meets the health system, be that a public health nurse, be that speech and language, be that in primary care, be it a GP consultation, or be it an interaction with a hospital? How will all of that you've gone through benefit the patient? If you could just, I know you mentioned it in your talk, but I think it's worth mentioning again.
Okay, so what we're trying to achieve is to address all the barriers, including what Gary mentioned there, that are inhibiting joint-up integrated care for patients, not just between acute and community, but within community as well, so that they transition between our services much more seamlessly. It's very clear to them how they access our services and how they transition through our services. So that, for me, is one of the main benefits of why we're moving down this road of establishing the regional health areas.
We've got time for probably one or two more questions. You can, of course.
So, I think there are a lot of moving pieces to this. So my question is that in terms of implementation, I can take from Paul as well. Two questions. One is, how will you measure success of this plan?
Mm-hmm.
And secondly, in terms of implementation again, do you plan to take a phased approach, starting with the POC, getting a playbook which can be implemented with the region, or do you want to go on a nationwide approach and implement everything? So do you want to rock the boat completely and say, okay, we're going to go nationwide approach, or do you want to take one region, go into a POC, get the success, KPIs, whatever, and then develop a playbook which can be implemented into other regions? How do you want to approach this one?
So the thinking at the moment is we will be moving forward with all 6 RHAs. That we are currently looking at aligning the geographies this year, how much of the structures could be stood up this year, and how safely it could be set up by allowing our service delivery leaders to continue to deliver on services safely. So there's an impact assessment, like I spoke about earlier, in terms of that. This will be a phased implementation over many years. So it is so complex. You can hear from me, there's so many decisions to be made, to be worked out with yourselves. So we don't have all the answers. We know that the geographies that is set, so we can start working towards the line that we know that we've devolved all the operations and so forth to the regions, and we're working through all that. So it will be a multi-annual iterative process to delivery and realising the vision of RHAs.
One more question. Yes, lady on the side there.
Just ask one question. Yvonne, it's really interesting. I think that the RHA is definitely the way forward. There's no doubt about that. I think it will create better integration. I think you've talked a little bit about kind of the what it is and why we need to do it, but I think the how piece, I mean, our organisation is so large, it's just huge, and yet you need to be able to empower leaders really to be able to enable this to happen. We're talking about really a whole cultural change piece on this within our own organisation. How staff will be equipped to be able to manage their own staff, frontline service, kind of staff that provide the frontline vision. How are we going to feed this in? I know you mentioned from the ground up and all that kind of, I think that's all really positive. But there's a big piece, and it's the how piece. How are we going to enable that to happen within our organisation and really tackle? We need to rely on so many of us actually to be able to help you with this process through the communications piece, but just staff on the ground, awareness, understanding. Is there any thought you put into that how piece?
Yeah, so at the moment we're identifying the what needs to be delivered over the next few months, right? And then it's the how. And it's working with the chief officers and the hospital group leads and so forth to really identify who needs to be brought on this journey, who needs to come work with us in terms of understanding the how we'd actually give life to these decisions. So the focus at the moment is on the implementation plan and the decision making and the impact assessment of that. And then, as well, it'll be brought in the how, but it's so complex. Like there's 140,000 people affected. It's massive. So it's such a complex program to get everybody involved. And there's huge, I suppose, political focus on it to move at pace as well. So we have to balance both those stakeholders.
Excellent. Well, listen, thank you very much, Yvonne. That's
Okay,
fantastic.
thank you.
Please thank Yvonne. She's been